Ever get that feeling? Like you're trying to wrap your head around something kind of complicated, something important, but it's just so dense. It's like wading through mud. Well, that's where the deep dive comes in. We cut through all that, pull out the good stuff, and give you a shortcut to really understanding, well, pretty much anything.
You can think of us as like the advanced scouts, you know? We go out there, map the territory, find the real gems, and then we bring them back to you, all polished and ready to go. Makes it a lot easier to connect the dots, right?
And today's expedition takes us right to the heart of something, well, it should be straightforward, but it's actually surprisingly messy. We're talking about how we define health, risk, and safety, particularly in the workplace. And we've got some super interesting material to work with, all coming from a really in-depth study done at Hutchinson Builders. They're a big construction company here in Australia.
But this isn't just your typical OHS kind of chat.
Oh, no, definitely not.
We're going to be pulling in perspectives from a whole bunch of different areas, like public safety, finance, even the military and healthcare, like a real mix of ideas.
The true melting pot, yeah.
And what we really need to grasp right from the start is why these definitions matter so much. We're not just, being picky about words here. Clear definitions, they're the bedrock of everything we do in OHS, both in how we practice it and how we research it. They shape the methods we use, the tools we create, and how we even measure whether we're doing a good job or not.
Okay, I'm with you so far. But let's get down to brass tacks here. What kind of practical headaches come up when, say, different people in the same company have different ideas of what safety means?
Well, the study really shines a light on this, how this lack of a shared understanding can really trip us up. Like back in 2016, Balderson, he did some work that suggested that a lot of organizations, they're chasing safety without ever really agreeing on what it is or how to get there. And even, gosh, over a decade ago now, back in 2013, Manuel went so far as to say that this fuzziness around definitions, it's actually holding OHS back from being seen as a proper, legitimate profession.
Right, yeah, because if everyone's got a slightly different picture in their head of what safe looks like, I can see how it would be next to impossible to get everyone on the same page, to actually put consistent strategies in place.
Exactly. And this isn't a new debate either. This struggle to pin down what safety really means, it's been going on for ages. Think back to like Rockland back in 99 and Slovic in 92. They both noticed that safety often ends up being more about like judgments and opinions rather than having clear, objective standards.
Interesting. So historically, we've tended to define safety by what doesn't happen.
Exactly. But there has been a bit of a shift, like more recently, towards thinking about it in a more positive way. So, for example, Hollnagel in 2014, he was very vocal about this. He argued against defining safety just as the absence of accidents. He called it, a consequence, not an actual definition. He said we should be studying why things go right, not just focusing on when they go wrong. But even with these newer ways of thinking about safety, as Karanicas and Zurgreen pointed out just recently, there's still loads of disagreement on, a single unifying definition. As Rockland put it quite well, safety is still a bit of a slippery, subjective idea.
It sounds like it's a moving target, really. So how did this particular study try to bring some clarity to this rather hazy landscape?
Well, what's really neat about this study is how grounded it is. They didn't just get lost in theory. They went out and got real-world data from workshops they ran at Hutchinson Builders, and they combined that with a really deep dive into all sorts of research, not just OHS stuff. They looked at public safety, financial risk management, military strategy, even healthcare. So it's this cross-disciplinary approach, which is pretty cool. The key point is this is empirical research. It's done in a real, live workplace, and their aim is to come up with definitions for health, risk, and safety that are actually useful, that can be applied in the real world.
So they deliberately looked beyond just traditional OHS stuff. And,
Yeah.
that makes sense, right? I mean, these are concepts that pop up in all sorts of different areas. So what did they find when they looked at how other fields define these terms?
Well, doing like a full-blown systematic review of everything out there, that would have been a huge undertaking.
Oh, yeah, for sure.
But they did give a really good overview of definitions from different disciplines. So let's start with health. Now, what's surprising is they found that there's actually a real lack of specific definitions for health in the core OHS literature itself.
Wow, really? That's pretty surprising considering how central the idea of, worker health is to the whole field of OHS.
It is, isn't it? So they looked further afield at areas like public health, health policy, medicine, and found that by far the most commonly used definition is the one from the World Health Organization way back in 1948. That one about encompassing physical, mental, and social well-being. And Larson, writing in 2022, he pointed out that this definition was a deliberate move towards a more holistic view of health, going beyond just, the purely medical stuff.
But that WHO definition, it's had its fair share of criticism over the years, hasn't it?
Oh, absolutely. People like Hofen and Leonardi, they've raised some really valid points. They argue that it sets the bar, incredibly high, maybe even impossibly high. They say it's not very, practical or easy to measure. They also suggest it blurs the lines between like scientific observation and moral values, and that
Mhm.
it doesn't really distinguish between just feeling a bit off, and having actual poor health. Some even say it could lead to like over medicalizing normal human experiences.
Yeah, those are some pretty hefty criticisms for such a widely used definition. So what are some of the alternative ways of thinking about health that the study found?
Well, there's a strong school of thought that sees health not as a static state of well-being, but more like an ability, a capability. This view focuses on our capacity to adapt to challenges, to manage our own lives, to meet our needs, and to interact effectively with our environment. Think of people like Kangelhem, Huber, and even later declarations from the WHO itself kind of lean towards this. Others lean more towards seeing health as like an individual trait, something inherent to a person, like strength, resilience, vitality, that sort of thing. The big takeaway is health is super complex, it's multifaceted, and contemporary thinking is definitely moving towards these broader non-physical dimensions.
Okay, that gives us a much richer, albeit more complicated, picture of health. So what about risk? I mean, we throw that word around all the time.
We do, we do. And the study points out that while the standard definition usually involves, some mix of probability and consequences, the way we actually interpret and use that definition can vary quite a lot. Lawrence, back in 1976, he was pretty influential in establishing that probability-severity link, and that's still a cornerstone. But Fishoff and his colleagues, they pointed out way back in 1984 that getting to a single, universally agreed upon definition of risk, it's a real tough one. Different disciplines come at it from completely different angles with different priorities.
Yeah, and it's not just about, cold hard facts and figures, is it? Our emotions, our own personal experiences, surely they play a huge role in how we perceive risk.
Oh, for sure. Researchers like Schoberg and more recently Chianis and Karenicas, they've shown how our emotional responses, our social context, even our cognitive biases, they all have a massive impact on how we perceive and evaluate risk. Things like, our individual personality, past experiences, deeply held beliefs, they all color our understanding of what's risky.
Right, so someone who's, say, terrified of heights is going to see you working on a roof as way riskier than someone who, I don't know, spends their weekends abseiling. Makes sense.
Yeah.
So moving on to safety itself, which, I mean, that's really at the core of OHS. Surely we've got a solid definition for that, right?
You'd think so, wouldn't you? But you might be surprised to hear that even the international standard for OHS management systems, AS&ZS, it doesn't actually define safety. The research literature throws up all sorts of dimensions. You've got safety as a state of low risk, safety as the act of controlling hazards, and safety as the creation of inherently safe working environments. A big takeaway across all these different views is that safety isn't just a fixed state. It's a dynamic process. It requires constant effort and adaptation.
Right. So we've established that there's this real lack of consistency in how we define these core concepts. So let's shift gears a bit and talk about the study at Hutchinson Builders itself. Can you tell us a bit about the company and how they went about doing this research?
Sure. So Hutchinson Builders, they're a major player in the Australian construction industry. In fact, they're the biggest privately owned construction company in the country. They've got like a huge workforce, around 1,500 direct employees. And then on top of that, they've got this massive network of subcontractors. So on any given day, they've got over 14,000 people on their different construction sites. Now, as the study points out, the construction sector globally has unfortunately got higher rates of accidents and injuries. So it's a pretty relevant industry to be looking at OHS practices. And then on top of that, Australia has a super diverse workforce culturally and linguistically. So it's a pretty representative context.
Okay, so a large-scale operation in a high-risk industry with a diverse workforce sounds like a really good setting for this kind of study. So how did they go about actually collecting their data?
They used a qualitative approach, mainly through face-to-face work stops with a really diverse group of their staff. They wanted to get people from different roles, departments, and different regions within the company. And importantly, they got ethical approval for the study. Each workshop had somewhere between 10 and 12 participants. And in total, 53 people took part. The group was a mix of men and women, and they had loads of industry experience. Like, the average time they'd been in the industry was about 20 years. They had a real range of roles, from dedicated health and safety people and site managers to, senior executives and project managers.
So a really good cross-section of the organization then. What do they actually do in these workshops?
They used this online platform called Padlet to get people's initial definitions, and they could submit them anonymously. The three big questions were, what is health, what is safety, and what is risk? Once everyone had put their answers in, they projected them all up on a screen, and the researchers kind of facilitated a discussion around them. They also shared some of the definitions from the academic literature that we talked about earlier, just to get people thinking a bit more deeply. It's worth noting that while they took detailed notes on, the overall themes and key points that came up, they didn't record what individuals said to keep things confidential.
Okay, so they basically got this real-time snapshot of how people within the company, across different roles and levels of experience, actually understand these fundamental OHS terms. What were some of the key patterns or takeaways from those responses? Let's start with how they defined health.
So when it came to health, the most common view, held by almost half of the participants, was that it's a state of overall well-being, including physical, mental, and personal aspects. About 19% defined it more broadly as a physical and mental state, without specifically mentioning well-being. Other perspectives included being free from illness or unhappiness, or having the ability to function effectively in daily life. What's interesting is, while physical and mental aspects were mentioned a lot, fewer participants specifically included the emotional side of things, and quite a few people didn't actually specify any particular elements of health at all. About 13% of the people linked health to their ability to, actually do their job.
So a general understanding, but the details were a bit fuzzy, with a clear focus on those physical and mental dimensions. What about their understanding of risk?
So their ideas about risk mostly revolved around the idea of potential harm, the probability or likelihood of something bad happening, and then how severe the consequences could be. And quite often, they combine these elements in their definitions. So, for example, a lot of people linked the potential for harm with the possibility of negative outcomes, and sometimes they factored in things like the level of exposure or the formal process of risk assessment. About 30% of the responses specifically combined the concepts of probability and consequences. There were also mentions of the risk assessment process itself and, the overall level of risk associated with a particular task or situation.
Right, so that traditional model of risk being like a combo of likelihood and impact, that seemed to resonate with them, but with, a bit of individual variation. And finally, how did the Hutchinson Builders folks define safety?
Well, this is where it gets really interesting. The most common view, held by over 40% of the participants, was that safety is mainly a characteristic of the activity itself, the way work is done. That was followed by a big group who saw safety as a state of being, and then those who thought of it as an ongoing process. Other perspectives included safety as a desired outcome, as a reflection of individual behavior or attitude, as an inherent characteristic of the work environment or system, or even just as a mandatory requirement. When they dug a bit deeper into what participants thought safety was meant to achieve, two key themes came out. Firstly, protecting health from harm or risk, especially when they saw safety as a state or an outcome. And secondly, proactively managing risks, which was more linked to the view of safety as an activity or a process.
Wow, it's amazing how even within a single company with, I assume, established safety procedures, there are all these different ways of understanding these basic ideas. Did the workshops explore how these different definitions might actually play out in their day-to-day work?
Yeah, they did. They had specific discussions about tailoring the definitions of health, risk, and safety for different levels within the company. The general agreement was that using, simpler, more accessible language would probably be better for the people on the front line, the ones actually doing the work. And then more complex, detailed definitions were seen as potentially more useful for, technical experts and senior management, the people involved in planning and writing up all those detailed safety documents. But a key point of agreement was that even if the level of detail varied, there needed to be consistency in the basic understanding of these terms across the whole organization.
Yeah, that makes sense. You don't want someone out on a site trying to decipher some super technical jargon-filled definition. Were there any other interesting observations that came out of those discussions?
Yeah, a couple of key things. First, a lot of people didn't really get the difference between mental, cognitive, and emotional health. They used the terms kind of interchangeably. The researchers ended up having to clarify those based on the established literature. And then there was also some confusion between the words hazard and risk. People sometimes use them in very similar ways or even define them the same way. So the researchers used definitions from recognized international standards to make it clear that a hazard is basically a condition or an object that could cause harm, while risk is the likelihood of that harm actually happening in specific circumstances.
So based on this combination of, reviewing existing literature and getting these insights from the Hutchinson Builders team, the study then went on to propose its own set of definitions, right?
Right. They came up with this really handy table that presented simplified, summarized, and comprehensive definitions for health, risk, and safety. The simplified ones were taken straight from the language that the workshop participants themselves used. The summarized definitions were then developed a bit further through discussions with the company after the workshops. And then the comprehensive definitions were where the study authors really got into it, drawing on all that research they'd done and their own expert knowledge.
And these definitions aren't just meant to be stuck in the workplace, are they? The study suggests they could be applied more broadly, maybe even in a public health context.
That's right. The research started in a very specific setting, but they deliberately framed the definitions to be applicable beyond just the workplace. The three different levels, operational, tactical, and strategize expert, are meant as suggestions for tailoring the definitions to different audiences. But the core ideas could definitely be used in other contexts, like the simplified versions could be really useful for public health campaigns aimed at improving general health literacy. And they've included detailed notes with each definition to make things clearer and make sure they're both general enough and specific enough.
Okay, so let's really dig into these comprehensive definitions that they came up with. What do they come up with for a more nuanced understanding of health?
Okay, so their comprehensive definition of health is combined physical, mental, and emotional well-being and capability in environments comprising specific material, physical, chemical, biological, technical, human-made, and immaterial, incorporeal human interaction products, agents. They specifically say that these immaterial agents include both direct human interactions like body language and tone of voice, and indirect influences like organizational norms, rules, and policies.
So it's very holistic. It goes beyond just our physical and mental state. It also considers our ability to function effectively in our surroundings and acknowledges the influence of, both tangible and intangible factors in our environment. What about their definition of risk?
All right, so the comprehensive definition of risk is potential for harm on health when not exposed to ORAND, not interacting with various material and immaterial agents of specific properties, agent properties and interaction exposure parameters, under relative capability to withstand single, concurrent, and repetitive adversities arising from those and other non-exposures or non-interactions. They give a broad definition of harm and clarify that properties refers to both the inherent characteristics of the agent itself and the specific way we're exposed to it or interact with it. And that phrase, capability to withstand adversities, it takes into account both our own resilience as individuals and the external support systems and resources that are available to us.
It's a pretty detailed definition, really breaking down that complex interplay of potential hazards, our engagement with them, and our capacity to deal with the fallout. And finally, how did they define safety in its comprehensive form?
So the comprehensive definition of safety is actions to eliminate or mitigate risks by avoiding, reducing, or withstanding harmful exposures to ORAN interactions with various material and immaterial agents of specific properties, pursuing, strengthening, or embracing necessary exposures to ORAN interactions with various material and immaterial agents of specific properties. They also clarify that these actions can be directed at the agents themselves, at changing the way we're exposed to them, or at improving the resilience of the individuals involved.
Okay, so safety isn't just about passively avoiding harm. It can also involve actively, seeking out and managing beneficial exposures and interactions, as long as they're properly controlled and understood. That's a really interesting distinction. So now that we have these proposed definitions, what are some of the key theoretical and practical implications that this study highlights? Like, why should our listeners care about all this?
Well, one of the central theoretical implications is how these definitions show the connection between health, risk, and safety. The authors sum it up really well. Health is influenced by risks moderated by safety. Their argument is that health and risk are the foundational concepts, and those then make safety a necessary part of the equation. They also propose this dynamic relationship, saying that changes to health are a measure of risk, and the other way around, changes to risk are a measure of safety.
Yeah, that's a really insightful way of putting it, really emphasizing that cause and effect. So how might these definitions change the way we approach risk assessment and management in the real world?
They really underline the fact that the level of risk isn't determined by just one thing. It's determined by a bunch of factors: how inherently harmful the agents are, the specific way we're exposed to them, how often or how much we're exposed, and our individual ability to cope with the consequences. And the study points out that the way we assess risk now often oversimplifies these complex interactions. They also talk about the idea of safety performance, and they make a really interesting argument that safety is performed and does not perform. What they mean is negative outcomes like accidents or injuries, they're the result of specific actions or inactions rather than being a direct measure of how safe things actually are.
So saying an accident happened because of a lack of safety, that's an oversimplification that doesn't really help us understand what actually went wrong.
Exactly. They separate interventions, which are organizational actions like providing PPE, from individual actions like the worker actually using the PPE correctly. This links directly to the principle of positive duty in OHS and the hierarchy of controls, which prioritizes eliminating hazards over just protecting people from them. They suggest that instead of using traditional safety performance indicators, we should focus on the relative safety level, which is how much protection is actually in place right now, and the relative safety effectiveness, which is the measurable change in the level of risk after we implement specific control measures.
Okay, that sounds like a much more proactive and informative way to actually judge how effective our safety efforts are.
Yeah.
What about the concrete practical implications for, OHS professionals out there doing the work and the people who develop safety policies?
For OHS professionals, these different levels of definitions offer a more standardized language that can really help with communication and collaboration across teams. The comprehensive definition of risk pushes for a more holistic approach to risk assessment. Makes you consider things that are often overlooked, like psychosocial risks. It also highlights the importance of putting resources towards building resilience in the workforce, not just preventing immediate harm. But the study also points out some potential challenges. Things like unintended consequences, like people overreporting perceived risks, and ethical considerations around allocating resources based on different levels of individual resilience.
And for the people who set the big picture rules and regulations around workplace safety.
Well, for policymakers, these more precise definitions could be a good starting point for clearer and more comprehensive OHS regulations. That could lead to more consistency in the language we use across different industries and regions. And that broader definition of health, the one that includes mental and emotional well-being, that has big legal implications. It potentially expands the responsibility employers have in those areas. It also suggests we need to rethink those traditional safety performance indicators that are often too focused on physical incidents. And it could even lead to better collaboration between government agencies, bridging the gap between occupational health and public health strategies more broadly.
It sounds like these redefined concepts could really shake up the way we think about and approach OHS at every level, from individual workers all the way up to national policies. The study also touches on some of the ethical considerations that come up with these broader definitions, doesn't it?
Yeah, they bring up a few important ethical points. For example, a broader definition of health could mean more monitoring of employees' overall well-being. And that obviously raises questions about privacy and data security. Recognizing that different people have different levels of resilience raises tricky questions about how to protect vulnerable workers without accidentally creating discriminatory practices. And defining safety as actions to control risks can also lead to debates about how much control organizations should have over work processes versus individual autonomy and responsibility. And, it's worth remembering that these definitions, especially the more holistic view of health, might not fit with everyone's cultural perspectives and values.
So while aiming for clearer definitions is really important, we also need to be aware of the ethical landscape and the potential for, unintended consequences. So as we wrap up our deep dive, what would you say is the biggest takeaway from all this exploration of redefining health, risk, and safety?
I think the core message is that it's absolutely crucial to have clear and comprehensive definitions for these three interlinked concepts. It's not just about, academics arguing over semantics. It's about creating a shared understanding that can actually lead to better OHS practices and better protection for workers in every industry.
And it's not just an issue at Hutchinson Builders, is it? The study suggests these different interpretations are pretty common across the board.
Yeah, absolutely. The fact that the definitions the workshop participants came up with were so similar to the range of definitions they found in the research really highlights that. And the study's really pushing for a change in how we think. It wants
Yeah.
us to see safety not just as something that's good for business, but as a fundamental public health duty, with the main goal being protecting and promoting health.
And that idea of having different levels of definitions, tailored for different roles within an organization,
Mhm.
that seems like a really useful tool for building that shared understanding and helping people communicate more effectively.
I agree. It allows for clear, consistent messaging at every level, from the people doing the work to the people making the big decisions. And this research is a real challenge to some of our traditional ways of managing safety and measuring performance. It makes us think more critically about how we define and measure success in OHS.
It's been a really interesting deep dive. It definitely makes you think twice about those terms we use all the time and whether we're all really on the same page.
It does, and it shows that moving beyond those simple assumed definitions can open up the way for better, more human-centered strategies for well-being and protection in all sorts of contexts, not just at work.
So on that note, here's a final thought for you, our listener. Take a minute and think about how these redefined concepts of health, risk, and safety might apply to your own work or even your everyday life. What does it really mean for you to be healthy, to be at risk, and to be safe in your world? And could having a deeper understanding of these terms actually lead to better outcomes and a greater sense of well-being for you? It's definitely something worth pondering even after our deep dive is over.